Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis.
Good morning. Let me remind you to please register your names here in front for the raffle. Don't forget to register your names so that you will be included in the raffle. There will be a raffle prize later. Ilan ba? Dalawa? Dalawang raffle prizes that will be given away by Cormay. So don't forget to register your name in front. Okay? There are two registration procedures. one at Cormay and one here in front. If you forgot to register online with Cormay, sulat din po kayo dito sa harap. Thank you. Don't forget. Thank you.
Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity, excess weight strains the pancreas, poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Geoff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Geoff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurately, providing reliable results. Fast delivers results in just 15 minutes. Critical for acute cases. Convenient screens for early-stage chronic pancreatitis preventing patients, whether it's an emergency or a routine checkup.
Harvard CPL Rapid Quantitative Test.
Is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Jov Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Joff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli Biocare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Intinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Geoff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood, as well as the use of artificial intelligence in veterinary medicine by Infinomed and the VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Geoff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood, as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test.
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Geoff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood, as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Geoff Carulio and I am the current president of the Philippine College of Canine Practitioners. And in behalf of the college, we would like to invite each and every veterinarian to the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma, and the third day is all about the blood as well as the use of artificial intelligence in veterinary medicine by Infinomed and VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Your dog's health is every owner's top priority. But what if your furry friend suddenly starts vomiting, shows signs of abdominal pain, or even strikes this prayer position? Do you know what this could mean? Today, we're talking about a serious health concern in dogs, canine pancreatitis. The pancreas is the second largest digestive gland in dogs, responsible for producing digestive enzymes and regulating blood sugar. When trypsinogen is abnormally activated, the pancreas begins to digest itself, causing inflammation. This is pancreatitis. It can be acute or chronic, and in severe cases, it can be life-threatening. This condition is more common in middle-aged to senior dogs and certain breeds, like poodles, cocker spaniels, and Yorkshire terriers. Besides the prayer position, common signs of pancreatitis include vomiting, diarrhea, and lethargy. Two major risk factors are obesity. Excess weight strains the pancreas. Poor diet. High-fat foods or overeating can overload the pancreas. If your dog shows these symptoms, seek veterinary care immediately. Early diagnosis saves lives. How can pancreatitis be diagnosed quickly? Traditional tests like amylase or lipase may not be precise enough. Now, there's a better solution. The Harvard Rapid Quantitative Test for CPL, Canine Pancreatic Lipase. Accurate measures CPL specifically, providing reliable results. Fast delivers results in just 15 minutes, critical for acute cases. Convenient screens for early-stage chronic pancreatitis, preventing complications. Whether it's an emergency or a routine checkup,
Harvard CPL Rapid Quantitative Test
is a trusted tool for your dog's health. Ask your veterinarian about it today. Pancreatitis is serious, but with proper prevention and timely testing, risks can be minimized. Watch their diet, schedule regular checkups, and cherish every moment with your loyal companion. See you next time.
Attention all veterinary medicine doctors. Get ready for an unparalleled learning experience. Join us at the Philippine College of Canine Practitioners Postgraduate Scientific Conference.
Hello everyone, I'm Dr. Job Carulio.
Hello, good morning everyone. We'll start the program in 10 minutes, so please settle down. Thank you.
To the first ever PCCP's postgraduate course, which will be happening on October 28, 29, and 30 at the SMX Convention Center at SM Ora, Taguig. The first day is all about the liver by Avli BioCare. The second day is all about the kidney by Vetmate Pharma. And the third day is all about the blood, as well as the use of artificial intelligence in veterinary medicine by Infinomed and the VetScan by Suetis. So, magkita-kita po tayo sa mga araw na yan. Salamat po.
Advance your skills and upgrade your knowledge. Brought to you by 3 leading companies in the industry. Learn, innovate, and be inspired. Together, we shape the future of canine and feline care. Join us or learn more by scanning the QR code. Reserve your spot now. Discover more and be part of this exciting journey.
Good morning, everyone. I am Dr. Gina Jeffrey Bailon, and joining me later is my esteemed co-host, Dr. Sherilyn Subiaga de Lima. We are honored to be your Masters of Ceremony for today's event, Harnessing Artificial Intelligence in Veterinary Medicine. We warmly welcome our in-person delegates and those joining us via Zoom. This event is held in partnership with Cormay Diagnostic Marketing Corporation and the Philippine College of Canine Practitioners, organizations dedicated to veterinary innovation and education. Before we officially begin, let us first offer this gathering to the Lord Almighty. May we invite everyone to pause for a moment of prayer. Let us reflect in silence and give thanks for the blessings of this day, for the gift of life, and for the opportunity to serve through our noble profession. Let us bow our heads as we pray.
Panginoong Diyos, pinapupurihan at sinasamba ka namin. Ang iyong mga gawa ay tunay na dakila. Ang iyong mga pagpapala ay hindi nauubos. Ang pagmamahal mo ay araw-araw naming nararanasan. Salamat sa araw na ito na kami ay muli mong tinipon upang magkaisa at matuto mula sa isa't isa. Tulungan mo po kami na ituon ang aming atensyon sa mga mahalagang bagay na mapag-uusapan sa araw na ito. Buksan mo po ang aming pangunawa at ang aming pandinig upang lubos po naming maintindihan ang mga mapag-uusapan sa araw na ito. Ikaw nawa ang maging sentro sa aming pagpupulong na ito. Sa inyo po namin inaalay ang katagumpayan ng pulong na ito. Sa pangalan ni Jesus. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, telas ng sinakanan, alam ng puso, sa dikit mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manluluping, di ka pasisingil, sa nagatang tutok sa simoy at sa langit mong pagaw, ay hinatang tulad, awit sa pagkayang minamahal, ang isang ng matawad mo'y tagumpay na nagtitindig, ang bituin at araw niya kailan ang ay di magtitindig. Luman ang araw ng walhagit pagsinta, tuloy ang langit sa piling mo. Ang inigaya ng pagkay mga api, ang mamatay ng dahil sa'yo.
Please remain standing for the Himno Veterinario.
Mahal ko ang Pilipinas, bansang mahal ng Diyos, dakilang lumikha. Mahal ko rin ang propensyong veterinaryo ng bayan at ibang panig ng mundo.
Alay sa pangmadlang veterinaryo, loobin ay makadiyos makatao. Marunong magilas, matatag sa paglago ng propesyon sa bayan at sa mundo. Mahal ko ang Pilipinas, tungo sa kanyang pagunlad hanggang wakas. Mahal ko ang lahing Pilipino, pagbabago sa bansa'y matatamo. Tayo ay nagpulong muli at nagkakasama. pagtataguyod ng kalusugan, mga alagang hayop sa bakuran kanayunan. Mahal ko ang Pilipinas, tungo sa kanyang pag-unlad hanggang wakas. Mahal ko ang lahing Pilipino. Nagunlad sa propesyon matatamo, nagunlad sa propesyon matatamo, nagunlad sa propesyon matatamo.
Thank you. You may now be seated as we officially begin our program. Let us now formally commence this esteemed event with the opening remarks. It is my honor to introduce a distinguished leader whose unwavering commitment to veterinary medicine continues to inspire us all. He is the current president of the Philippine College of Canine Practitioners. Please join me in welcoming Dr. Geoffrey Marl Carulo, PCCP President, to deliver the official welcome and opening remarks.
Magandang umaga po sa inyong lahat. Pasensya na po kayo kasi medyo Lunes ngayon, na traffic yung ibang tao. Pero sure ako pagdating ng alauna, kompleto na tayo. Anyway, kailangan na nating magsimula. So, sa muli, magandang umaga po sa inyong lahat. On behalf of the Philippine College of Canine Practitioners, it is my great honor and privilege to welcome you all to today's scientific seminar, Harnessing Artificial Intelligence in Veterinary Medicine. As veterinarians, we are entering a new frontier. Artificial intelligence is no longer just a concept in science fiction. It is here shaping the way we diagnose, we treat, and care for our patients. From advanced diagnostic tools to predictive health technologies, AI is opening possibilities that can transform veterinary practice and improve the lives of the animals entrusted to us. Today, we are fortunate to learn from distinguished experts who have dedicated their research and practice to advancing veterinary medicine through technology. Dr. Wen Chi-Lin, who will shed light on the diagnostic value of microalbuminuria versus SDMA in renal assessment. Dr. Jose Marie L. Castro, who will discuss the significance of microalbumin testing in canine kidney disease and its integration with AI analysis in canine practice. And of course, Dr. Bon Lee, who will share how advanced technology is applied in antibiotic susceptibility testing for pets. Their expertise and insights will help us not only understand the science, but also envision how AI can ethically and effectively applied in our daily clinical practice. As a practitioner, our duty is twofold. Number one is to embrace innovation and at the same time remain grounded in compassion. AI is a powerful tool, but at the heart of every technology must remain the healing hands and caring heart of veterinarians. I encourage everyone to actively participate, ask questions, and exchange ideas. Let this seminar be a platform for where knowledge sparks collaboration, and collaboration leads to progress, not just for our profession, but for the welfare of every pet and pet owners we serve. With that, I officially open today's program. Thank you, and let us all look forward to an enlightening and inspiring day ahead. Pax et bonum.
Thank you, Dr. Carulo. We also extend our warm welcome to our delegates joining via Zoom. Please remember to send your questions anytime. We will address them after every special case presentation. To provide us with an overview of Cormay Diagnostics and to introduce today's topic, we are honored to have with us Dr. Jomar Castro. Dr. Castro is a highly respected veterinarian known for his expertise in diagnostic solutions and his commitment to advancing animal health through innovation. His insights bridge both clinical veterinary practice and cutting-edge diagnostic technology, making him the ideal person to present the company profile of Cormay Diagnostics and set the stage for our discussion today. Please join me in welcoming Dr. Jomar Castro.
Thank you, Doc, for that wonderful introduction. Magandang umaga po sa inyong lahat. I want to welcome you to this very, very enlightening event and seminar where we will be absorbing so much information today, something that I have not done for a long time. Okay? Ladies and gentlemen, esteemed colleagues, and honored guests. Today, I am thrilled to discuss a topic that is revolutionizing the way we practice veterinary medicine. The impact of artificial intelligence cannot be avoided, okay? Especially in clinical practice. And we are focusing on the modernization of technology as every day we live. I remember the time that I always tell my kids not to use ChatGPT and AI when doing their homework. Tama ba? But we cannot stop them from doing that. As I speak, you may also think that my speech may be from AI. Tama ba? Okay. There will be 3 topics today that will enlighten you. We are having a antibiotic susceptibility machine, which is the first here in the Philippines. We also have a biochemistry analyzer, a blood test machine that is very modern today that can compete with the big players in blood test machines. And I am thrilled to say that we're trying to share a modern technology on fecal analyzers, one that is really swept me off my feet because, as you can see, I am already a dinosaur. When I was studying, we didn't have cell phones. Now I am here in front of you trying to explain a gadget that is really unbelievable. Okay? Later on, most of our colleagues will join us. Traffic lang po. Okay? As we all know, veterinary medicine has come a long way in recent years, and AI is playing a significant role. Fecal analyzing, okay, antibiotic susceptibility, and biochemistry, CBC. I am blessed to have tested these modern machines, and I would like to acknowledge Cormay, who has been very, very generous in providing me in my clinical practice this wonderful modern technology. As we all know, it's very, very hard to trust suppliers with a lot of things. But I have entrusted my practice to Cormay. For your information, let me tell you that Cormay is a subsidiary. Cormay Diagnostic and Marketing Corporation is a subsidiary of Murex Philippines, okay? They have been in the medical field distributing and providing service in the human medical field for almost 27 years. So this is why I have given my full trust in my practice to the team of Cormay. Let us give them a hand. Okay. Without further much more to say, let us learn today on modern gadgets. I want you to open your mind and your hearts like I did because I'm already a dinosaur. You know that an old man, sabi nga nila, no, you can't teach an old dog new tricks. But now we cannot avoid that. So I bid you good luck today as we learn and more information that we can observe today. Thank you very much.
Thank you, Dr. Jomar. Our first speaker, Dr. Bon Lee, holds bachelor's and master's degrees in engineering science from the National Cheng Kung University and a PhD in power mechanical engineering from National Tsinghua University. A former engineer at TSMC, Dr. Lee founded MedFluid during his doctoral studies and has received several prestigious awards, including the 13th National Innovation Award, 2019 Entrepreneur Outstanding Award, and the Grand Prize at Innovex Pitch Contest. Please join me in giving a warm welcome to Dr. Bon Lee.
All right. Good morning, everyone. Good morning. Thank you for joining me today. And I'm Bon Lee, the founder and the CEO from MedFluid. Our company is dedicated to bringing cutting-edge microfluidic technology into practical and real-world medical, human, and veterinary diagnostics. And today, I'm going to introduce you to our complete point-of-care testing system with a focus on NEST, which is the first-in-class in-house antibiotic susceptibility testing system. And so over the next half hour, we will explore the challenge of antibiotic resistance and also the why the current approaches fall short, and also how our patented microfluidic solutions solve this problem in a way that's accurate, fast, and also affordable. So let's first of all let's talk about our company. So MedFluid was founded in 2019 with one mission, that is we make biomedical tests more affordable and easier to use for everyone while maintaining the accuracy and the reliability for everyone. And so our core technology is the integrated lab-on-chip microfluidic system. And we have 12 patents protecting our two main technology. One is the pneumatic membrane type microfluidic design. Another one is the self-liquid driven microfluidic design. And we are headquartered in Taipei, Taiwan, with the R&D center in Hsinchu. And also we have the manufacturing facility that has the certification in ISO and QMS standards. And so far we have 2 products, including all-in. That is the all-in-one PCR diagnostic system. But it is in development so far, so just looking forward to it. And the other one is the Nest, which is the one I'm going to show you. It is the rapid antibiotic susceptibility testing designed specifically for in-house veterinary clinics. And so since our inception, we have achieved several significant milestones. Like in 2016, I received the Taiwan National Innovation Award. And also in 2019, we won both the Grand Prize and Startup Terrace Awards at the pitch contest during Computech Taipei, which is very famous over the world for the semiconductor field. And in 2022, we were selected as one of the top 12 medical startups at the medical startup competition in Germany. And also in 2023, we launched the next product. And so until now, this kind of achievement has helped us to expand the networking and also move closer to our goal for transforming diagnostics. And our team is our greatest strength. So I bring my background as an engineer at TSMC, which is a very famous semiconductor company. And I got a PhD at National Tsinghua University with mechanical background. And so I just commercialized my PhD topic to the product in math fluid. And so I specialize in microfluidics and point-of-care systems. And also my R&D head, Dr. Kevin, is a microbiologist with deep expertise in product optimization and development. And my product manager, Juanita, is a well-trained veterinarian from National Taiwan University. Yeah, so she's bringing a lot of frontline clinical insights and also customer support experiences. So yeah, we have a great team to help us growing in the market. And so as for myself, just as I mentioned, my background is the mechanical engineering. So after I graduated from my master's degree, I joined TSMC as an engineer. But during the career of being an engineer, I just quit my job with a very sad story. Yeah, because my father died due to very serious sepsis. Yeah, so while my father was treated in the emergency room, but after treating with antibiotics, but my father was getting worse and worse. So by that time, I just asking the doctor why my father's condition is like no any better situation. But the doctor just answered me that because he has done like the new antibiotics to treat my father, but it doesn't work. So just finger crossed, yeah, to pray, yeah. So just waiting for the culture data. After 7 days, then he can decide which antibiotic is the best one. So by that time, I was hopeless and wondering how come this kind of leading words, but there's no any better solution to solve this kind of issues. Yeah, and then yeah, of course, after several days, my father just passed away. Yeah, so it is a very sad story behind this startup. Yeah, so after that, I just quit my job and went back to my professor and started to invent this kind of product to solve the antibiotic resistance. Yeah. So so let's talk about the problem we are solving, which is antibiotic resistance, or AMR. So this is a One Health issue, meaning it affects humans, animal, and the environment together. So according to WHO and CDC data, MR was responsible for 5 million people deaths in 2019 alone. But it's not just for human. In the veterinary spaces, it is reported that 72% of diseased animals suffer from multi-antibiotic drugs, and also spreading the resistant genes through wastewater, animal feces, and soil, and even the frequently interaction between the pet and pet owners. So it's kind of a global crisis that requires action at every level, including veterinary diagnostics. So the current method for antibiotic susceptibility tests are often time-consuming and expensive. So delays in testing leads to delays in treatment decisions, which can worsen the patient outcomes. So in many cases, empirical therapy, that means prescribe antibiotics without knowing if they work or not, becomes the norm. So this contributes to unnecessary antibiotic use and the acceleration of the antibiotic resistance. So it's very clear. Yeah, apparently the challenge is that we need faster and more accessible and more reliable AST solutions that can be done directly in veterinary clinics. So in today's standard process, a pet suspected to be infected is sent home after a sample is collected. And the sample is shipped, and then the sample is shipped to a central laboratory where culture and sensitivity testing takes place. So the whole process for the AST can take up to 7 days, during which time the animal is untreated or treated blindly. So our next system changed that. With the in-house testing, the veterinarian can go from samples collection to an antibiotic efficacy results in as little as 6 hours, including 2 hours of culture, bacteria culture, and 4 hours of AST reaction. So this allows for evidence-based decisions on the same day, improving outcomes and reducing resistance. So so before we go into the details for the AST and the technology behind that, it's important to understand the current method used for AST. So this kind of organization called CLSI, which is Clinical and Laboratory Standard Institute, has developed a lot of use of developed standards and guidelines within the healthcare community. And the committees on veterinary antibiotic susceptibility testing reviews a lot of data from a variety of sources and studies like in vitro and PK/PD, and also the clinical studies. So they are going to establish antibiotic susceptibility testing methods and breakpoints, and also the cutoff values, and also the QC parameters. So let's go to talk about AST. So AST is a method that to help the user to find out which antibiotics is the effective ones to kill the bacteria. Yeah. So according to the FDA, so this kind of tests are essential in guiding therapy, preventing misuse of antibiotics, and combating antibiotic resistance. So in the veterinary field, ASC helps protect not just the health of pets, but also the health of the broader community by reducing the unnecessary spread of resistant genes from animal to humans. But unfortunately, the methods currently available have significant drawbacks, so which I'll walk you through in the next few slides. So the first method is the broth dilution method. This involves preparing a series of dilutions of an antibiotic, then mix them with culture medium. And the isolated bacteria is added to each dilution, and the mixture is incubated. So after incubation, the presence or absence of bacterial growth is observed. And the lowest concentration of antibiotic that inhibit growth, which is known as the minimum inhibitory concentration, or MIC, is recorded. And so this kind of the advantage of this kind of method, it's quantitative, and it closely simulates the bacterial behavior in a liquid environment. But for the drawbacks, apparently it is a complex and labor-intensive method, and also costs a lot of visual, like the visual error by doing the manual interpretation. Yeah, and so in practice, here shows how it works. So from the culture to the results, this kind of method takes up to 48 hours, including 4 main steps. So it is far too slow for urgent treatment decisions. And the second one is the most commonly used method. It is called disc diffusion test, also known as Kirby-Bauer method. And in this approach, small paper discs with different antibiotics are placed on an agar plate that has been inoculated with a pure bacterial culture. So after incubation, the diameter of the inhibition zone is measured, and the size of it is to determine whether the bacteria are susceptible, intermediate, or the resistance. So while simpler to perform than the broth dilution, this kind of method is qualitative rather than quantitative, subject to visual judgment, and can suffer from interference between closely placed antibiotic discs. And so here's going to show the steps for this method. So very similar to the broth dilution method, it also costs at least 48 hours for the whole procedures, and also it is prone to inconsistencies due to manual measurement and interpretation. And for the third method is to use automatic machines to do this test, such as the Vitec 2 from Biomedics. And this system use also the cartridge containing 17 to 20 antibiotics, and can report results in 4 to 18 hours, but not included pre-culture time. And this kind of results can provide not only the AST, but also the MIC value. But however, this kind of automated machines are bulky and also expensive, and are not designed for veterinary clinics, and also not tailored for veterinary drug panels. So, sorry, it's doesn't work. So this brings NAS, our solutions. So the first in-class solution for in-house antibiotic susceptibility testing in veterinary medicine. So our system delivers AST data compared with MIC values in as fast as 6 hours. And this speed is possible because our patented microfluidic cartridge and our portable analyzer. So, this streamlines the entire workflow from culture to interpretation. So by enabling same-day results, NEST cannot empower veterinarians to make evidence-based treatment decisions during the golden treatment hours, reducing ineffective treatments and slowing the spread of resistance. And so how it works, so the NEST cartridge contains 33 preloaded antibiotic reaction wells covering 15 antibiotics across different concentrations. Plus, a color indicator allows the real-time detection of bacterial viability. And the analyzer automates the culturing, image capturing, and also the AI-based result interpretation. And the testing can be performed on a range of sample types, including blood, pus, urines, and any kind of specimen you collected from patients. So, and also include aerobic and anaerobic bacteria. And also the system combined with compact size and easy of use, so makes NEST unique for veterinary clinics. And our portable analyzer was measured just 14 by 27 by 17.5 centimeters. So it is small enough to place in the any kind of veterinary clinics. And it features, just as I mentioned, that some intelligent functions. So we just keep speak of this kind of illustrations. So let's gonna to see how the our patented microfluidics works. So this cartridge is the heart of the NEST system. It's designed to be easy to handle, avoiding cross-contamination through our gravity-driven design. So each well contains precisely 20 microliter of liquid solution, and the array format allows for multiple antibiotics at different concentrations to be tested in parallel. And this precision ensures reliable results and reduces the amount of sample and reagent needed. So here shows our 4 panels are ready for sale. And also we are developing another new panels, including cefalvacin and mofofloxacin. So this product, the procedure for this product is very simple. Just takes 3 steps. So for the first step, after you collect the sample from your patients, then just put it into our special medium and do the culturing, and then after 16 hours, 2 to 16 hours, once showing the color change and temperature change, just put the solution into our patented cartridge. So by using our gravity-driven design, so the liquid will accordingly flow into each well evenly, like 20 microliter, as I mentioned, and then mix with the pre-dried antibiotics inside. And so after inserting the cartridge into the analyzer, so the analyzer will real-time monitor the column change and give out the report within 3 to 6 hours by using AI algorithm. So it is the procedures that NEST is going. And compared to the conventional method, NEST can not only test patients' responses to 15 antibiotics within 6 hours versus 7 days from the central laboratory, but also lower down the cost to be less than $20 with the same accuracy rate of 90% with the traditional method. So here comes to the mechanism of the algorithm. So we adopted the indicator which is the re-excitation dye. So once the bacteria is growing, then the color of indicator will change to pink color from blue color. So basically, using this kind of principles, so the machine can analyze the photos to give out the SC report for each antibiotics with the 3 categories like susceptible, intermediate, and also the resistance. So it's just some characteristics for the microfluidics cartridge. So just the evidence that each well, the volume of each well is evenly 20 microliter of liquid solutions. And also our Malaysian clients also collected around 80 cases for producing this kind of heat map. And so, so they collected different type of specimens like ear discharges, respiratory fluid, and also some skin pus and urine samples. And they're gonna to build up this kind of heat map to help them to do the empirical therapy more wisely and more accurately. And so we also have done the validation data in Taiwan. And here comes to the, sorry, it is absent, yeah. So the detection time is 16 hours in average, and also it is shortened like 10 times shorter compared to the traditional method. And so our agreement with the gold standard distribution method was around 85 to 90%, demonstrating both speed and accuracy. Yeah, so this kind of results confirm that NEST can deliver the same lab qualitative assay data in a fraction of the time. So this comes to the raw data for each antibiotics. Yeah, so in average, over 400 comparison drug tests. Yeah, so it turns out that we have 90% of agreement compared to the distribution method. So since our launch, we have acquired over 80 customers in different countries, and also we got 8 pilot customers over the world, and also there are some customers waiting in queue for pilot round. So looking ahead, our roadmap includes expanding new antibiotic panels and also integrating more AI features to help us to improve the accuracy rate, and also scaling production line to meet our growing demand. So we are not just for veterinary. We are planning to get FDA approval in 2027 to help us to expand the human market for solving the antibiotic resistance. So thank you for joining me today. Yeah, so I'm very happy to answer your questions. Thank you.
Thank you, Dr. Lee. If you have any questions for Dr. Lee, please kindly hold on. We will get to those questions after the presentation. So thank you again, Dr. Lee. To illustrate the clinical application of this technology, let's please welcome again Dr. Jomar Castro, a University of the Philippines graduate and owner of ConsultAVet, who will present a special case on antibiotic susceptibility testing.
Combining technology and clinical practice truly brings this concept to life. So let us now welcome again Dr. Dr. Jomar Castro.
Thank you. Okay, I'm tasked to share to you the cases we have in the clinic. My practice is Consultavet. I have my team here to help me. I was very blessed to test this very first machine in the Philippines. It has a counterpart machine, antimicrobial susceptibility machine in humans, in hospitals, okay? But the problem is, it's very expensive. Now they have adopted a machine that will be tailor-made for pets. So this machine has been very helpful for me in my practice. So let me start off with okay. But before that, let me first play a video of the machine. It's very, very easy to operate, and it will only take a few minutes to put in the specimen. It has a cartridge of the 15 antibiotics that will be tested with the specimen. After sealing the cartridge, it is placed inside the machine, and it will take around 6 to 8 hours more after incubation. Okay? So this is the process on how the machine is operated. Now let me go on to the case. Our practice takes us to so many patients, and it's very, very crucial for us to treat them, okay, at the soonest possible time, okay? Nowadays, it's very, very hard in our practice because most of our clients take to social media whenever they are dissatisfied. I, for one, has been very, very careful with that. This is the reason why our practice has partnered with Cormay to help us avoid any skirmish or what you call a lawsuit, diba? So that's something that we should always consider all the time. Now, let me take you first to the why it's done. So, balik muna tayo sa school, okay? I don't want to bore you with stuff, but antibiotic determines how effective what we do against a specific bacterial infection, okay? Now, the primary purpose of the test is to ensure that the correct antibiotic is used, okay? Uh, I have seen so many of our colleagues and in other practices and in the US, we use not just one antibiotics, but a combination already. When I was starting my practice, we only use very, very basic antibiotics. To my surprise, there are so many practitioners now that use third and fourth generation agad na antibiotics whenever they treat any kind of infection, which makes it very, very difficult for them. When your patient gets old, you will already have a dilemma. We do not notice that, okay? Most of us tira ng tira with the antibiotics without knowing that later on, your client will come back and nothing already works, di ba? Yun ang problema eh. So it determines which antibiotics are effective against a specific bacterial infection. It is a critical diagnostic tool. We do not notice that, okay? And the primary purpose of the test is to ensure that the correct antibiotic is chosen, okay? If not, okay, it can lead to treatment failure. It can lead to treatment failure, prolonged illness, and the development of antibiotic resistance. That's something that we do not look into before we treat, right? And if a client comes back, galit na siya. Why? Because he is questioning how we treat the patient. Because they feel that we are very inadequate as doctors in treating their fur babies. That is so true, okay? So we are trying to avoid these kinds of problems, okay? What is the cause of antibiotic resistance? Let me just walk you through this, okay? Overuse and misuse of antibiotics. What is overuse, okay? I've seen in a lot of practices, when I ask my friends, most of the time they use doxycycline for how long? 3 months? Diba? 3 months for Ehrlichia infection. Okay? Diba? So, wow. Some of them, 6 months. Okay, is that true? Is that true? Okay. Ehrlichiosis is very hard to treat, especially when the species, babesiosis and other species come into play. Okay. Did you know that bacteria mutate already? Okay, like viruses, like COVID. Okay. Other bacteria like the influenza virus for bird flu, they mutate. And so is bacteria. So we have to be careful in using it, okay? Did you know that it has horizontal gene transfer, okay? What do I mean by that? When you use a lot of antibiotics in combination, it increases the chance of gene transfer, the resistance with two combining antibiotics. So we have to be careful and be sensitive enough in using antibiotics so that later on, when your patients turn 15, 16, 17, 18 years old, nothing will work. Okay? I've seen this in the past. Okay? There is a selection pressure. It's really very hard for us to choose the right antibiotic. So we're very, very pressured because there are a lot, I will mention later in my other slides, which species of bacteria has the most resistant genes, okay? In the recent years, you would notice that research has a difficult time in producing newer antibiotics. And I believe bacteria has catched up and viruses has catched up in the way we develop antibiotics. Mas nauuna pong nag-mutate yung bacteria and virus even more faster than we think of a newer antibiotic. And that's scary, okay? I recently attended a workshop in UPLB wherein the Bill Gates and Melinda Gates Foundation founded a foundation for this kind of a project. Okay, they're trying to look for newer ways to treat infections. Kaya mas nauunahan tayo ng virus and bacteria rather than curing it. Okay? Whenever you treat, like for example, I handle a kennel, okay, a breeder, example. He has like 100 dogs. It is very, very hard to prescribe medicines over and over again if they have poor infection control. Okay? So it's always better to prevent rather than always treating them, because always treating them will lead to antibiotic resistance, especially you vets that handle big kennels and big breeders who has been puppy mills in the past. Okay? They think, Doc, just prescribe me a medicine and everything will be okay. It's not that. Okay? Later on, it will catch up on you. What you're prescribing doesn't already work. Hindi na po gumagana yung antibiotic. Prescribe lang tayo ng prescribe. Okay. I remember in the past, I had a farm, a pig farm, a swine farm before. Okay. And I had friends, I had Chinese friends who had big piggery farms. Okay. When I was starting, my farm was small. Okay. Before we market the pig, they gave me a medicine that would make my pigs, stockier, bigger. Okay. I didn't know what's inside that medicine because they want to help me sell better. They want the live weight of my pigs to be heavier so that I can earn more as a businessman. Okay, they didn't know I was a vet. To my surprise, when I had that product analyzed, it's a powder product that you mix with the feeds so that you can give it to your pigs at 90 days onwards. It will make your pig heavier and bigger. So you will earn more as you reach market day. Okay? To my surprise, what's in that product? Okay? It's salbutamol. Okay? I'm letting you know right now that agricultural use of antibiotics is really very, very rampant and we cannot control it. Okay? It has caused antibiotic resistance in humans, and whenever you feed your dog also with table food, you're the same. You're the same. So whoever has asthma here, choose where you buy your meat. Okay? And that applies also with our pets. Okay? It's been all the time happening and we don't notice it. Okay? Okay? Factors to consider before choosing the right antibiotic for your patient. Okay? Your patient comes in, they will ask treatment for you. Ano po ba yung inyong criteria bago kayo mag-antibiotic sensitivity testing? Okay? The right antibiotic for you use. Okay? Siyempre, alamin nyo yung type of infection, if it's respiratory or circulatory, metabolic, depende sa inyo. Okay? You have to know also the bacterial species that you're dealing with. Okay? You have to know, ito yung sinasabi ko kanina, you have to know whenever a patient comes in, I have been in practice for so long, and I've seen my patients grow old. So that's the advantage of me being a dinosaur, kasi matanda na po ako. Nakita na namin yung patients namin grow up and become old. But I have never monitored what antibiotics I give them every time they come in. For example, I give you an example. 14-year-old dog. Okay, I have a case here later. Every year they come in, they get sick. How many medicines have you prescribed in the last 14 years? Diba? Have you checked that out? I know you have records, but okay. What is the clinical presentation? Okay, you have to check that out, syempre. Okay. What is the antibiotic spectrum? Okay, broad spectrum ba? Are you using, there are special antibiotics, right? That is good for the skin, specific. For me, as an old vet, I use specific medicines so that I lessen the risk of antibiotic resistance because I am old. And we don't have, before we have fewer antibiotics, unlike now that you use a combination of antibiotics already. Okay? This is a nerdy kind of thing that you would look at the pharmacokinetics and pharmacodynamics and the potential side effects and toxicity. Okay? Of course, number one, dapat ito yung number one eh. Cost and availability. Okay? Not all of the clients can buy the antibiotics that you prescribe. Okay? Now, I am surprised kasi there are third and fourth generation amoxicillins that has been being prescribed already for our patients. One, ano ba yung ng Pfizer? It's, okay. So, it's also important for us, always, yung vet clinical judgment. Kasi it's always dependent on us. What are the key scenarios when a veterinarian would recommend an AST for a pet? Okay? Your patient comes in, paulit-ulit po yung infection. Okay? Bakit ganon? Okay? What do? Do we change just the antibiotic to another antibiotic? What if it does not work? Okay? What if it does not work? On the third time, I had a patient, okay, may CKD. We give them antibiotics. It seems to get worse all the time. And the client, galit na sa akin. Doc, bakit yung antibiotic na binigay mo hindi gumagana? Okay, I can't answer that. Okay, right away. Until I do a test. But I do a test. Okay, I send a test to a laboratory. Example, DVL. How much time do I need to get the results back? It came to a point that my patient died already before the results came in. And that's sad. And it's my fault already, right? When in fact, it should not be my fault, right? Okay? Next. Ano yung mga sakit na yun? The diseases that require an antibiotic sensitivity in my practice, we have made a protocol for this to make antibiotic sensitivity a protocol for problems like pyometra, CKD, recurring wounds that don't heal, and yung most of the time dental problems. Sa pusa, madalas, okay, in cats. It always happens. It's very helpful to do the test. Next, the lack of response to initial treatment. This has been a problem for me because most of the older vets, like me, okay, say this to the clients. Subukan niyo po muna tong antibiotic na to, balik na lang po kayo pag hindi gumana. Tama ba? Diba? Okay. Then, you would notice, hindi na babalik yung client. Bakit? Nagpunta na siya sa kabilang clinic. Kasi, nasa Facebook ka na tomorrow. Si Doc, hindi magaling si Doc. Kasi, hindi tumatalab yung pine-prescribe niyo sa akin. Kaya lumipat na ako kay Doc sa kabilang clinic. Okay? I hope that does not, it always happens. Okay? Okay? Third, serious or life-threatening infections. I'll give you an example. I had a patient that was hit by car. Okay, hit by car, the bladder ruptured. Okay, so it is very prone already for peritonitis, pleural effusion, and all. Okay, what do I do? Should I give him amoxicillin lang? I will not risk it already because it is very, very prone in a few days, peritonitis. Okay, I need to do the AST already. Okay? Next. Ayan, no? Those diseases that is very prone to septicemia, especially pneumonia in older dogs. My take is around 8 years old pataas. Ang age, I do the AST already. CKD na merong pyelonephritis, very hard to treat. Very, very strong antibiotics should be used. Okay? And infections known to high rate of resistance. What are those? Okay? What are those? Okay? Yung methicillin-resistant antibiotics. Okay? I have a list here that I will check out for you. Okay? Ano po ba yung methicillin-resistant antibiotics? Okay? Ito po yung meron kayong pyoderma. Those who treat here na merong atopic dermatitis. Okay? If atopic dermatitis gets worse, merong pyoderma. Okay? Sometimes you treat them with antibiotics, pero you do not know yung pus-producing bacteria that causes the skin infection, resistant na pala. Wounds and abscesses na pabalik-balik, especially in older dogs. And surgical incision sites. Okay? It has, you do not know if it's methicillin-resistant Staph aureus, meron na siya. Okay? Next is also ear infections. Ear infections that keep happening over and over again. You do an oral hematoma, it comes back because the client is not very complying. It's not complying with your ano. So, oral hematoma comes back paulit-ulit. Remember, if you do not drain it properly, next time around, meron na siyang Pseudomonas. Okay? And these are the bacteria that is number one in developing resistance. Okay? Enterococcus infections. Okay? Enterococcus infections are one with, kunyari, magkakaroon po ng hemorrhagic enteritis yung inyong patient. Okay? Okay? Meron pala siyang CKD. It happens, studies show that the problem with the bladder and the kidney, the bacteria that grows there, goes up the digestive system. Okay? Meron na pong study na ganon. And it's an enterococcus infection. How would you know? You wouldn't know. You wouldn't know until such time that you do an antibiotic sensitivity test. Okay? Number one ideal model for me to do a antibiotic sensitivity testing is yung geriatric patients. 7, 8, pataas. Okay? I do not, now I will implement it in our practice that it should be done. Okay? I understand the price, usually we always think of the price. Okay? But for me right now, it has much more weight to test than make the client angry after a prescription. Okay? So geriatric patients. Okay? One more. Okay. Okay. Infection in critical areas, like for example, the eyes, brain, and bone. When you give an antibiotic in these special regions of the body, the antibiotic has a very, very difficult time penetrating the bone, the eyes, and the brain. Okay? And it's very, very susceptible that your antibiotic will not work. Okay? So, how long a treatment should you do before you change the antibiotic? Okay? When in fact, you have the chance to test it already and change it immediately. Okay? Okay? Ito, I mentioned it already, post-surgical infections. Okay? And before using the last resort or costly antibiotics. Okay? This is always a line by the clients. Okay? Doc, how much more will I spend before the prescription works? Okay, how many consults? Is it like 3 times, 4 times? I believe when the 3rd time comes, bago na po yung vet na pupuntahan niya. Okay, bago na. So, we have what we call antibiotic stewardship. I'll explain it later to you. Kasi DOH, the Department of Health, has a program for antimicrobial resistance and how to avoid it. So, we, as doctors, should implement it also. Okay? So, this was what Bon is mentioning a while ago on the standard sending out of samples to DVL and to other laboratories. How long will it take? Okay? But let me tell you this. When you do this, this is syempre the gold standard. Okay? The gold standard. Because here, they will identify the bacteria present. And it will take around 3 days for them to identify it. 3 days. Okay? And it will take them another 4 days to test the antibiotics that is sensitive to your pet whenever you send the sample. Most of the time, give or take, less than 2 weeks before it comes back. Am I right? Am I right? Less than 2 weeks. Okay? My dilemma is my patient still alive by then? Okay, that's the problem. And that's why I mentioned this to Cormay. How can I fix this dilemma? Okay? Now, it has the same principle. It has incubation, okay, and same principle as result interpretation. Kasi it has, we will determine susceptibility, resistance, and intermediate. Okay, let me explain intermediate. Okay, intermediate is in the middle. In the middle. Okay, what do you do if you get a result of intermediate results? You will just double the dose of the antibiotic for it to work. Okay, that's the intermediate. Okay, now let me go. This is how it looks like. It's here. There will be a demonstration later on how it works. Okay, but the minimum time average is before you get the results is not 1 week. It's not 1 week. It's 24 to 36 hours. Okay, you get the results, and that's for me a relief. It really solves most of my problems. Okay, I have case number 1. Okay, I hope I still have time. Okay, si Daisy. Daisy is a 12-year-old female boxer. Okay, he has this blackish vaginal discharge that has been happening for 3 days. That's, well, you have idea already na baka pyometra na to, di ba? Pyometra na to. How does pyometra work? Pyometra works in a very surprising manner. Okay, it first shows up whenever your patient is in heat. Tama? In heat siya. But the discharge is not blood. It's a blackish vaginal foul-smelling discharge. Okay, so for us vets, it's a no-brainer. No-brainer. Pyometra to. But how do you confirm it? How do you confirm it? You might be wrong. Kasi if you might be wrong, he might transfer to another clinic who has tests. Okay, ikaw, kwento ka lang. Pyometra yan. Doc, how do you confirm that it's pyometra? So you have to do other tests, right? You have to do other tests. Confirmation is the key to the practice now. It's no longer old school na ito yan, kasi ito yung clinical eye. It's no longer that. People have Google. People have AI. Okay? People have AI. Okay? So we tested AST. Okay? This is, on the left side, is the real, how the test looks like when we print it. Close up yung right. You would be surprised, okay, for a 12-year-old dog, okay, 12-year-old dog, look at this, okay. How many resistant antibiotics are present? Almost all, right? Pati ako na-surprise eh. I was surprised, all right. And which one is sensitive? Almost none. Almost none. Merong intermediate. Okay, I did not write here the treatment because each of us all has treatment. But we gave, Doc Jen and I gave him like co-amoxiclav, I guess. Co-amoxiclav. Usually, co-amoxiclav eh. But it did not work, guys. It did not work. Okay. Dalawa na lang. I do not, we have Doc Bon here because most of the antibiotics that they used in their first cartridge are the ones that are available in Taiwan, right? In Taiwan. I do not know what meropenem is, but I know the gentamicin, right? Okay. So we had to change antibiotics, okay? So after a few treatments of the adjusted antibiotic, nawala na yung discharge. But we all know, pyometra, it will come back, and sometimes it will come back with a vengeance. Diba? For a 14-year-old dog, you will think twice in doing surgery. So that's our dilemma now. How do we do the surgery? How can we make it safe? Because in 6 months' time, the heat will come back. Okay? 6 months' time, heat will come back, and it will come back with a vengeance unless you do surgery and remove the source of infection. Tama? Okay? We did other tests. Okay? Meron pa ba tayong ginawang test dito, team? Ayan. Crazy, di ba? We did a CBC, and it showed up normal. Okay? Dapat, I know you guys have like great gadgets at home. Dapat i-ultrasound talaga eh. Okay? So, one that we cannot do now because kinonfirm na namin eh. So, we're trying to our team is careful in this because it's 12 years old. Nakakatakot is surgery, di ba? Nakakatakot surgery. Okay? Okay. Case number 2. Okay? Si Rosette. Okay? It's a 14-year-old poodle. Actually, this case is so funny, okay, because meron siyang discharge. Okay? Foul-smelling discharge. Then, on the same day, they brought their other male dog into our clinic because nagkaroon ng paraphimosis. Okay? Why do you think nagka-paraphimosis yung other dog? Why do you think? It's because of the vaginal discharge. It smells like in heat, di ba? So kapag merong vaginal discharge, may pyometra yung isa niyong aso na female, sigurado magwawala yung male. He wants to mate. Nagkaroon ng paraphimosis. Ang cute, di ba? Sabay sila nandun. May paraphimosis yung boyfriend niya, siya may pyometra. So we did a test. Okay, it's been happening for 3 weeks. Okay, she was diagnosed with Ehrlichia before kasi matagal na namin siyang patient eh. That's what's puzzling about having being an old vet kasi 14 years nang dinadala yung aso sa amin. Parang ganun, di ba? So Ehrlichia positive siya. So we did a CBC comprehensive blood test, an ultrasound, and antibiotic susceptibility test. Okay? Ito na ngayon yung antibiotic susceptibility test. Ayan na naman. Ito na naman po tayo. Okay? Ilan ang resistant antibiotics? You would notice here the word augmentin. I mentioned this to Doc Bon. Augmentin is coamoxiclav. It's just a brand popular in Taiwan. Okay? So, I do not have meropenem, but I had to change it to enrofloxacin. Okay? Now it worked. But again, we should think ahead because in 6 months' time, it will come back. Okay? On a 14-year-old dog, will you do surgery? Will you do surgery? Wala ka naman choice, di ba? Sasabihin na lang, Doc, galingan mo na lang. Okay? Galingan mo na lang, Doc, ha? Doc, wag mong papatayin yung aso ko, ha? Funny. Scary, no? Scary. But we don't have a choice. Mention to the client, 50-50. That's the famous line, 50-50. If we do this, we do this. We damn if we do, we're damn if we don't. Okay? So, okay. We did an ultrasound. Ito yung maganda rito. Okay? And I'm not really good at ultrasound. I had my team here to help me with this one. Itong isa, this one on the lower right corner, you will see anechoic structures of the bladder, up and down is syempre magkatabi yan eh, yung uterus at saka yung bladder. And the uterus showed signs of impending pyometra. Okay, yung right side. This requires really training, I know. Ako din, hirap na hirap. Pero we have younger vets who are better at gadgets. So we seek their advice. Okay? Itong nasa baba. Okay? Tingnan nyo ulit yung WBC niya. Diba? Funny about pyometra, no? When it's starting, WBC doesn't go up. That's funny, diba? That's funny. Most of the time, it goes up if it's really in the worst condition. But now, it's not. It's normal. And you have to explain that to the client. And if the client doesn't understand it, ang hirap, diba? So, ayan. So, may ultrasound. Okay? Case number 3. Okay, onti na lang to kasi excited lang ako ikwento sa inyo. Okay, ito naman, 14 years old, si Loki. Meron siyang sugat, wound all over the body, and it's not responding to treatment. He's been our patient for so long, and we do not remember how many times and how many antibiotics we have given in the past. Mostly doxycycline, mostly, so dapat you have to keep your records nice. Okay? Okay, so we did CBC, comprehensive blood test, and AST samples. What were the samples used in the NAST machine? Pus. What's really nice about this machine is you can do urine. Urine actually is the best. Pus, okay, discharge from swab, okay, you can do it in that machine. So here we go. Ito, medyo mas konti lang naman yung resistant na antibiotics. And mostly, ilan ba ang sensitive? 3, 4. Okay. So, okay ka pa. Okay ka pa dito. So, we had to change the antibiotics to, ano ba yung ginamit natin dito? Something the Cefa? Convinia yata, no? Guys, Convinia yata yung ginamit na namin dito para tumalab na. Kasi for the longest time, I remember, may Ehrlichia rin yata to. So, most of the medicines used is doxycycline. Okay? So, ito yung CBC niya and yung biochemistry machine, biochemistry results. Tignan nyo, yung WBC, hindi siya masyadong mataas. So, unless you look at the other parameters, okay, it's not really very helpful. That's why it's not enough to just do one test. It's not enough. You have to dig deeper and you have to explain the client na medyo gagastos siya para malaman natin to. Kasi you're protecting your license for this. Okay? Okay. Okay, last. Oh, this is the last case. Okay. 1 year and 10 months. He's a Persian cat, color point. Daw. Hindi ko nga alam kung ano yun eh. Pero female, frequent sneezing with nasal discharge. Ito, bingo. I call this the bingo patient. Okay, because we tested 4-way. Okay, okay. FCV, FCOV, okay. And it was he was pregnant. And yan yung dystocia, nagkaroon siya ng dystocia before. Test done, CBC, comprehensive blood test, and AST. Okay? Here, ito naman baliktad. There's a lot that's sensitive. So, cute, di ba? This is much better, okay? Much more positive for us to treat. Madali lang. Kasi resistant antibiotics are very few. But if you don't have this, what if you choose cephalexin? Look at that. Okay. Intermediate pala siya. Dapat you have to double the dose for it to be effective. Right? Am I right? Okay. So, this machine has really been very helpful for me. So we did also the 4-way tests. I am not really a fan of 4-way tests. When I was working in the US, they don't use these rapid tests. These rapid tests, they base their diagnosis on blood tests alone in the US. Alam niyo ba yun? Okay. And for us here in the Philippines, it's easy to buy. But most of the time, if you get an error all the time, once the temperature of the test kit changes. Nilagay mo, inventory, na-stock siya sa mainit na room, magbabago na lahat siya. Paano? Matutuyo yung fluid inside. So I don't base, we did this, syempre depende pa sa client who you will ask permission from, and it's not cheap, di ba? It's not cheap, okay? So here, the good thing about this, yung WBC niya is so high, 27. And we did tests, okay? And this is my last slide, okay, before we have lunch, okay? Antibiotic stewardship. The DOH has a program for this, okay? It's a coordinated set of strategies and practices aimed at improving the use of antimicrobial drugs to preserve the effectiveness and protect public health. Okay, I'm very, very fond of this machine. I want to thank Cormay for making me use it because we've already programmed it in our protocols, especially for geriatric patients. Okay, although I understand it has a cost, but it's how good we as vets explain it to our clients. We do not, I always say, I do not want my reputation and my license tarnished. This is the reason why I ask them to approve this test. Okay? I want to thank you for listening with the case. Okay? Let's eat lunch. Thank you very much. All right.
Thank you, Dr. Lee, Dr. Castro. Before we take our lunch, okay, so we're opening the floor now for questions from both our in-house and Zoom delegates. So if you have questions, as I'm sure you have, we are now opening the floor. Okay? So Dr. Castro, Dr. Lee is here on stage to answer any of your questions.
Okay, anyone here has questions? I can go sa inyong table, or you can go up front to ask them personally. Questions?
Or sa Zoom? Meron ba sa Zoom?
Or the Zoom?
Okay, to get this party started, no? So maybe I can ask a question, Doc. So regarding dun sa antibiotic sensitivity test, my question is, what would be the ideal? How do you prepare the ideal sample for this? Kasi for example, we're talking about pus, most likely from either a pyoderma or anything like that. During the treatment, most clients will, that's why we're going to do the antibiotic sensitivity test. It's most likely the treatment is not going well, or it's not naman well, but it's not, we're not happy with how it's going. So is there any special way to prepare the sample to maximize the accuracy of the machine? For example, for the pus, should we stop putting ointments first, or is it okay to get the sample even though they are currently using the antibiotic? Things like that. So before to maximize the sensitivity of the machine, do we do to prepare the sample? That's my question.
All right, thank you. Yeah, thanks for your question. So regarding the, I think you are saying that the success for growing rate for the different types of specimen, right? Yeah. So it's all about the bacterial concentrations inside the samples. So basically only for blood samples, it is full of like the cells, like white blood cells, and also a lot of red blood cells inside this kind of samples. So we have to do the centrifugation for the sample pretreatment. Yeah, but it's very quick. Just use the vortex, like use 5,000 RPM with 30 seconds to spin down the cells to the pellet. But just transfer the supernatant, the liquid sample, and go just put into the culture medium.
Okay.
And also, yeah, just culture it for 2 to 16 hours. Then, because according to our special medium, which is full of the ingredients to grow bacteria substantially with a very short time. Yes, so I think just for human blood, you need to do this kind of comparative pretreatment. But for other samples, it is very simple. Just put it into our culture medium.
Okay.
Yeah, and directly. Yeah, just directly. Yeah, because we have 2 steps for doing this kind of procedure. So the first step is to pre-culture to enrich bacteria to a certain numbers for AST.
Okay.
So it doesn't matter what kind of specimens used for these procedures and used for this test.
All right. Thank you, Dr. Lee. Dr. Castro, would you like to add on?
I would like to add on, depending on what clinical I mentioned here in my table, in my presentation, the clinical manifestation of the disease. Example, if it's pyometra, you choose the discharge, you collect the discharge. If it's CKD, what will you choose? You choose the urine. Okay, so depending on the clinical manifestation, that's where you determine which sample to use. The most difficult sample to process is blood, because you have to separate serum from the rest. So that's what Dr. Lee is mentioning, that you have to centrifuge your sample, if it's blood, am I right, at 5,000 RPMs for 3 seconds? 30 seconds, okay, 30 seconds for you to get the sample serum needed to incubate in the machine. So there's a lot of samples that can be used: pus, blood, what else? Urine, okay, yung swab, ear discharge, all. It's very, very easy to use. That's why it's, for me, comparing it with the laboratory sending out, okay, they give you a test tube, but you have to wait for less than 2 weeks for your results to come back.
All right, so basically it's a very versatile machine. We can use a lot of samples. We can use a variety of that. For the blood, it would be the most challenging, so it will require centrifugation at 5,000 RPMs, about 30 seconds. But for the rest, you can do it directly. Okay. And no special preparation, just directly. Swab, and then, okay. All right, thank you so much.
There's a special test tube.
Doc, if there's, okay, a question from downstairs. Doc, introduce your name po and the clinic.
Good morning po. I'm Trisha from EV Dog and Cat Clinic po. Follow-up question ko lang po. Regarding sa urine sample, will the method of collection matter po for the result? Is cystosynthesis the best method of collection, or free catch will be okay po? Or
All right. Because as I mentioned in my slides, we have done some validation data using urine samples. So we both did the two kinds of collection ways for the sample collection, but the result turns out there's no differences between these two methods. Yeah, so yeah, it's done made what kind of collection way you use. Yeah.
There are two ways, Doc, to collect samples with urine. Example, yung external collection. Remember, you wait for the patient to pee. But that's very, very difficult to time. Kasi sometimes what we do in the clinic, we walk him out, the dog, tapos since it's toilet trained, free catch the urine. Free catch. But sometimes, the problem with that is the contamination. Contamination from the prepuce to the collection bottle. So there's much more bacteria that comes into play whenever you do that. So it would be best, actually it's the most ideal way to do cystosynthesis. Okay? Cystosynthesis wherein you inject a needle into the bladder and collect it there. That is the most ideal way, I think, for us to collect the samples to avoid bacterial contamination.
Doctors, another question?
Hello, good morning. I'm Dr. Lavinia Perez from South Hills Veterinary Clinic, Iloilo. So I just have a concern regarding the submission of samples. So here in the Philippines, not all of us can afford right away to buy a machine. So we do referrals. So for example, I have a colleague, and for example, I have already the machine, and then they will be sending the samples to us. So how's the handling, or how can we ensure that the sample is not contaminated? So do we need to put it in a iced cooler or something? So that's, or a sterile container. So that's it. Thank you.
Okay, thank you. Thank you for your question. So regarding the shipping conditions, right? Yeah, because of the after you collect the samples, then the bacteria is very weak while maintaining in the room temperature. So we recommend you ship the samples in a like the 2 to 8 degrees Celsius within 24 hours. Maybe you can use the cool box to put some ice bags inside. Yeah, and within 24 hours. Yeah, it is better to get the accurate results. Yeah.
I have a question, Doc Bon. Is it ako pa may question eh. Do you think it's okay to refrigerate the sample before bringing it to the referral lab? Yeah, for processing. No. So immediately after collection, we should send it out. Okay.
Yeah, it should be better because the bacteria is still dying. Yeah, after collected from the patients. it should be it is better to get the real results. So it is also the drawbacks for the central laboratory. Yeah, because of the some logistics and also yes, shipping condition is not stable. So sometimes, most likely, you got some negative result, but apparently it is some physical signs for the patient that is infected. Yeah, so that's why our product want to solve this kind of issues. Yeah, and also we do have some. It's okay. We do have some protocols for shipping conditions. Yeah, so don't worry about it. Yeah.
I suggest, because I understand not all of us here can really afford a machine. Sometimes when we have a lot small practice and we're starting off, we cannot afford a machine. So we understand you in Iloilo, you can start off like doing one machine and offer the services of antibiotic sensitivity to your other neighboring clinics, so that you can be of service then you'll be helping a lot of practitioners with their practice if you help them out with Cormay can train you with that and help you do that service in others. Because my clinic, Consult a Vet, we offer that service also to our neighboring clinics who can't afford buying the machine but needs that service. So we help them out with that. Thank you.
I'm Dr. Olido from De La Salle Araneta University, a pathology professor. Now my question is, if a patient is presented to the first clinic and then it transferred to the second clinic, now the second clinic has no knowledge that it was given an antibiotic. Now my question is, will it affect the result of that machine?
Okay, sorry, just repeat your question. So are you saying that if the patient has been treated with antibiotics in the first clinics, so now the patient is sent to the second one, and then the doctor just do the AST test for this patient, so does it affect the results, right? Okay, so yes, so because we recommend that the vet in the second one need to wait for 3 days. 3 days after treating the medication of antibiotics, because it's a real like affecting the results while treating with antibiotics on the patient. Yeah. So basically, yeah, 3 days. Yeah, 3 days after. Yeah.
After the first.
Yeah.
Before you test.
Okay.
Yeah, before for your test. Yeah, using this machine. Yeah.
Hello. This is a question from our Zoom participant, from Dr. Charlotte Kane. The question is, in cases of pyometra, the patient is also positive with Ehrlichia, Babesia, and Anaplasma, but the NAST result that the patient is resistant to doxycycline, metronidazole, and clindamycin, or even enrofloxacin. Which are antibiotic used for blood parasitism, and how would you treat the blood parasitism?
Wow, that's a very difficult question. Yes, I will try to answer that. Yes. Most of the time, we treat the patient, for me, which infection is much more life-threatening. Correct? That's my take. Because if the pyometra is so much worse, okay, since it is already resistant to most of the blood parasite sensitive antibiotics, you cannot use doxycycline or maybe choose another one, okay? You may control the infection first. Maybe for me, if it is sensitive with, for example, enrofloxacin, diba? Try to control the infection of the pyometra first, okay? Or look for an antibiotic that may be helpful in treating the next, treating the Ehrlichia, the blood parasite problem next. So there are a lot of choices. Maybe you can use imidocarb or something else. But for me, as my take, I will use the antibiotic sensitive